While the coronavirus vaccine has given some of us hope, health officials are urging us to remain alert. Eyewitness News 3 reporter Rachel Thabby is standing by live with more on their concerns.
Thanks, Bree. In a meeting this morning, the Public Health Department, area hospital officials, and even a county commissioner talked heavily about COVID case rates and gave numbers. For the second week in a row, Bonneville County will have the second most new COVID cases in the state, according to the state's coronavirus website. And the health district says there's one big reason for it.
During many of our case investigations, we're talking with individuals who have not isolated as they become ill.
They've actually seen a number of patients who won't isolate until testing positive. Hospitalizations have also gone up. Eastern Idaho Regional Medical Center went from as few as 6 patients a couple weeks ago to 20 as of Wednesday. Of those, 4 are in the ICU. They've also had several transfers from around the area.
By no means are we back to where we were back in November, December, but we are not headed in a good direction at all right now.
Idaho Falls Community Hospital went from having 1 patient at the end of last week to having 14 as of Thursday. The increase has forced the hospital to reopen their dedicated COVID ward.
It seems like it had died off, or at least started to decline to lower levels. For about 2 or 3 weeks, that was a very welcome repose, and then the last week or so, it's really had a dramatic increase.
Morton adding this plea to the public to not get complacent.
You know, just on a very anecdotal case of just me walking around the stores the last few weeks, there's a lot less masks than I saw just 2 months ago. And I think that has directly correlated to this. I think we are at a very dangerous precipice, and we better be on our guard.
Now, they're also stressing the importance of continuing to wear a mask and social distancing, even if you've gotten the COVID vaccination. Live in Idaho Falls, I'm Rachel Thabby.
All right, thank you so much, Rachel.